What's up, everybody? Happy Monday. Welcome to another episode of Learn with Flo. If you are new here, I'm Lauryn Moore, host of our Learn with Flo, and owner of the Lowdown Functional Medicine. So I'm super excited for you guys to join us today. If you missed the start of our February series, we've been diving into all things autoimmune disease, a very, very big topic, a very relevant topic. We covered some pretty shocking stats last week, but if you missed our episode last week, just know that there are over 50 million Americans today, which is more combined than those that struggle with cancer and heart disease combined, right? So this is a big number. 50 million Americans right now that are struggling with some sort of autoimmune disease. So it's a very big population of people. And unfortunately, about 80% of those are women. We talked a little bit about why that might be, and we'll dig into some of that more in today's episode as well too. But I really wanted to take the month of February and dive into this very relevant and very I think important topic, because it highlights just one of the many areas where we get to witness in action some of the differences between more of maybe a conventional medicine approach versus maybe more of a root cause medicine approach, and even our total understanding of autoimmune disease, our working theories of why autoimmune disease is happening, and also our overall toolbox of different things that we want to do with our patients that are struggling with autoimmunity to be able to really find overall relief from more of a conventional medicine standpoint, or in more of a functional or root cause standpoint, be able to find full remission. That's really my ultimate goal for individuals and patients that are curious about that as well too. So if you missed the start of this series, last week we really started to pull back the curtain on what is autoimmune disease. We started to define autoimmune disease. We started to kind of tell us what maybe our more conventional medicine definition or understanding is of autoimmune disease, but then also be able to talk about some of the more deeper causes of this immune dysfunction that we're really seeing when these autoimmune patterns are present. So just as a quick recap of last week, we talked about, from a conventional medicine perspective, I guess you could say maybe more of the current definition that you tend to hear a lot from a conventional medicine standpoint is that autoimmune disease occurs when the immune system is mistakenly or randomly, you can see me use air quotations just because I think words are very important. Autoimmune disease is when the immune system is mistakenly or randomly attacking our own tissues. And last week, I really kind of challenged you guys to think about it maybe from a different perspective and really think about, what if that's not the case? What if this isn't just a random case of mistaken identity, and in fact, the immune system is doing exactly what it's designed to do, but it's not attacking you, it's actually trying to protect you from something. And that, like I said, whoosh, kind of blew our brains a little bit around this kind of conventional understanding of autoimmune disease, because then that leads us down totally different paths and totally different theories of why autoimmune patterns are increasing at a 300% clip year over year. That is wild, right? Absolutely wild. And what you get more of a conventional medicine is an understanding of like, oh, it's just genetics, random luck of the draw. And I'm like, I don't completely buy that, because then that also disempowers us as patients to think that we can really do anything about it, right? So if you, like I said, missed last week's conversation where we really started to talk about what autoimmune disease is really, what are the more alternative theories to why autoimmune patterns are happening, and also really be able to kind of touch base with some of the common myths behind autoimmune patterns, that's exactly what we talked about last week. So all the way from theories around an overflowing toxin bucket, the contribution of our nervous system and trauma, leaky gut, hidden gut dysbiosis and infection, there's kind of a theme, right? There is a theme that goes back to our gut, and we're going to continue to talk about this time and time again. And so I think one of the biggest things that we tend to kind of see in more of the autoimmune perspective from a conventional standpoint isn't just maybe a little bit of what I might call an outdated definition or even an outdated understanding of autoimmune disease, which is then preventing us from moving forward in being able to provide more relief or, like I said, even full remission for people. So if we're not on board with the same definition, then of course we're not going to have really even a similar toolbox behind it, right? So this is where conventional and functional medicine are going to be very different in how they define autoimmune patterns and therefore how they treat autoimmune patterns as well too. And I think one of the biggest areas that we kind of see this in is even the whole process of being told, I don't know if that was the right word I was really looking for, but the whole process of seeking out a diagnosis, or the whole process of actually getting to the place where you realize that a lot of the symptoms that you're dealing with maybe are actually an autoimmune pattern. So that's going to be very different from more of a conventional medicine standpoint to a functional medicine standpoint as well too. So the truth is, based off of, like I said, what we talked about last week, the truth is that autoimmune disease is not just a random attack on the body. It's actually a response to something deeper that needs to be addressed. And also, we get to learn that then autoimmune disease isn't necessarily a life sentence. It's something that we're not just destined to be stuck on medications forever, just hoping to manage the symptom and manage a future flare-up. It's like, oh, wow, that's so promising. We know that the body has these really innate abilities to regulate itself if we just get out of the way, and also if we give it the right tools to be successful as well too. So this is where I think, in going into today's topic, I really want to talk about how we're getting to the diagnosis of autoimmune patterns to begin with. And just as some more fun statistics for you, it takes approximately 5 to 6 doctors and almost 7 years for someone to receive an autoimmune diagnosis. And to me, that is just absolutely absurd, and honestly unacceptable. Like, I don't accept that standard of healthcare, because to me, it's because to get to that point, you are obviously operating under a mindset and a model of a wait and see approach. We're not having any sort of proactive care or proactive diagnostic testing if it is taking us 7 years to be able to diagnose someone with something. It's progressing behind the scenes, and we're just waiting for it to become something that's like in our face, and it's like, oh, this is what it is, when really it's probably been bubbling under the surface for years or even decades before someone can receive an accurate diagnosis. And that to me is just not okay. And this is where more of the conventional and functional medicine side of things will very much differ. So I think a lot of people, again, just because of this conventional medicine understanding of like, oh my gosh, your body is randomly attacking or mistakenly attacking your own tissues. And I think when we operate under that definition, it's almost this unspoken thought process that like, oh, autoimmune disease just happens overnight. Like, one day my body's not attacking itself and the next day my body is. And it's like, actually, autoimmune disease doesn't just appear overnight. That's not how really any disease processes really happen in our body. It develops in stages, and sometimes it's, like I said, actually years or decades before someone's able to actually get diagnosed, and for someone to help them put all of the pieces of the puzzle together that they have been experiencing. The frustrating part, though, is conventional medicine usually doesn't catch this until significant tissue damage has been done, because that is their diagnostic criteria, is like wait and see until X amount of damage has been done. But I'm going to pose to you guys a different possibility, a different reality, a different belief system that I've seen in my practice every single day, is what if you could detect autoimmunity early before it actually progresses into full-blown tissue damage? What if you could intervene before a complete disease pattern actually takes hold? And that's what I think is really cool and really important to differentiate. Is that is possible. We just have to have the right mindset, right? Because the mindset of conventional medicine is moving someone from dying to surviving, right? So they don't have the diagnostic mindset or the diagnostic criteria to catch it before you're dying. I know it sounds, like I said, extreme and morbid, but like they don't have the diagnostic criteria to catch it until it's actually causing systemic dysfunction. Whereas more in a functional medicine standpoint, I'm going to start to recognize when someone is barely surviving and they're definitely not thriving, right? It's like, no, I stopped thriving a long time ago. I feel like I'm just surviving to get through my day with extensive fatigue, crazy amounts of joint pain, lots of headaches, lots of inflammation, unexplained weight changes, skin issues, gut changes, like you name it. It's like, oh, we can already see some of these things brewing under the surface, but it's going to be years or decades if we just sit on our hands and wait for it to become bad enough to diagnose it. Like, I don't aspire to that. I think there's a better standard of healthcare that we all deserve, and that's to be more preventative and more proactive in our approach. So let's really dive into how autoimmune progresses, because then when we start to recognize how it progresses, one, we can recognize how to catch it early, and two, you guys can feel equipped with knowledge, which is always powerful, knowledge in terms of like what testing to ask for and what types of things to monitor in yourself as well, to be able to detect some of these patterns early and then be able to course correct so that this doesn't end up in full-blown autoimmunity patterns as well too. So we're going to dive into the 3 different stages of autoimmunity and how it develops over time. We're going to talk about how conventional medicine often misses some of those very early warning signs, and how more of a root cause medicine approach and our toolbox can catch autoimmunity a little bit sooner, and most importantly, what you can do to stop it from progressing further. So, sounds pretty good little curriculum that I have for us today. So let's just go ahead and dive in with the 3 stages of autoimmunity. Again, this is not a process that just happens suddenly and like one day you wake up with a diagnosis like Hashimoto's or lupus or rheumatoid arthritis or psoriasis or Crohn's disease. It's like you don't just wake up with it. But the reality is autoimmunity does develop over time, often silently, in some of these first initial stages. So the 3-stage progression, number 1 or stage 1 starts with what we call silent autoimmunity. So the immune system is on high alert. You may not have a lot of overt symptoms yet, or a lot of symptoms that really catch your attention, right? Let's put it that way. So at this stage 1 for silent autoimmunity, at this stage, your immune system has started making what are called autoantibodies. This is going to be an important term for us because autoantibodies, auto meaning self, right? And antibodies meaning attacking against, right? Our immune system creates antibodies to viral pathogens, bacterial pathogens, all sorts of stuff throughout our lifetime. Like antibodies are good, but autoantibodies means that our body is actually creating antibodies against our own tissues, right? Things that are in and of itself. So some of the most common autoantibodies that you can actually measure, although like I said, it takes bending an arm and a leg to get conventional medicine to measure some of these things. It would be some of the autoantibodies like what are called thyroid peroxidase antibodies or TPO antibodies, thyroid globulin antibodies or TPG antibodies. Sometimes they're called anti-nuclear antibodies or an ANA panel. Like these are things like these autoantibodies are things that from a conventional medicine standpoint, they won't even check these things in blood work until, like I said, they suspect that there's like full-blown autoimmunity happening. But these are some of those autoantibodies that already start to show up early, cluing us off to an immune system that's a little pissed off, right? And so it's creating some of these autoantibodies, and you may not feel anything yet, maybe just subtle symptoms that don't seem really connected, like fatigue, random joint aches, maybe some mild gut issues. And this is where conventional medicine is definitely going to miss this silent autoimmunity. One, because they're not measuring for these autoantibodies and the symptoms aren't severe enough for them to warrant any sort of further workup or further diagnosis. So it's like womp womp, we're kind of just like, we tick that mark. It's like we're not thriving, we're kind of moving towards surviving. But there's actually things you can measure in blood work that will clue these things off, which is why when I start with somebody that's interested in working through some of their symptoms from a functional medicine standpoint, and say we start with something like my functional wellness consult, I run thyroid antibodies on everybody, right? And it's like 90% of the time they might come back clear. 10% of the time I might be telling somebody for the first time ever, I'm like, do you know that you have autoimmune patterns? And they're like, no, I had no idea, right? And it's like, wow, someone to really help validate a lot of the symptoms that they're struggling with, and then we can put together a proper plan of attack versus just a wait and see kind of approach. Stage 1 of that silent autoimmunity will progress into what's called stage 2, which is more reactive autoimmunity. You may see some sort of symptoms beginning, no diagnosable pattern yet. This is where symptoms like more present and persistent fatigue, brain fog, joint pain, gut issues, skin rashes, hair loss, right? But you go to your doctor and they'll likely say like, oh, ship shape, like labs look normal. Here's some anti-anxiety meds. Here's an antidepressant. Here's a laxative, like just helping you kind of manage some of those uncomfortable symptoms. But they're not really digging into why you're having those uncomfortable symptoms. And that's because, again, standard lab tests really aren't looking for these autoantibodies. They're looking for like advanced disease markers, right? That's just the different toolboxes. It's not good or bad. It's just like there's one toolbox over here and there's another toolbox over here. And more of a conventional medicine toolbox, they don't use those autoantibodies unless there's good reason, like a lot of tissue damage and symptoms. So usually stage 2, this right here, this is really the stage, I think, where this root cause medicine really shines, okay? Because we're able to detect these things before autoimmunity is actually happening, before there's like full-blown tissue destruction happening, and we have actual diagnosable disease at this point. Because then eventually, stage 1 of silent autoimmunity, where just the autoantibodies are starting, will progress to stage 2, which is more reactive autoimmunity, where the symptoms really now start to set in. And then eventually we're going to progress to stage 3, where now we have a full-blown autoimmune diagnosis. There's tissue damage, there's autoantibodies present, usually in the thousands now, whereas maybe if we would have measured it in more of the silent stage, it would have been in like the hundreds, and now we're in like the thousands, right? So they're like off the charts. At this point in time, enough tissue damage has been done that you probably meet some sort of diagnostic criteria to go ahead and give what you're experiencing a name, right? So you walk out with a diagnosis of like Hashimoto's, multiple sclerosis, rheumatoid arthritis, Graves' disease. There's so many other ones. Crohn's disease, right? It's like the list goes on and on and on. And I'm like, guys, they're all the same thing. Even though they're manifesting in different tissues, Crohn's is going to manifest in the gut. Rheumatoid arthritis is going to manifest in the joints. Even things like fibromyalgia is going to manifest in the nervous system. Things like Hashimoto's or Graves is going to manifest in the thyroid, right? It's like, it's just different tissues that the body is going after, but they're not necessarily separate disease etiologies. It's still the same progression, right? Which means that even though they're different tissues of the body, it's the same kind of root cause, right? Which is very interesting. And this is not necessarily what is accepted by a conventional medicine theory, which is why they have such like a wait and see approach. So usually by that stage 3, that full-blown autoimmunity, this is where conventional medicine is going to start to pick up on actual tissue destruction in your lab work. So in stage 1, we could measure some early stage thyroid antibodies, right? But maybe your classic thyroid panel still looks ship-shape. By stage 3, not only do we have the autoantibodies, but now we also have your TSH is elevated, your T4 is in the tank. And so now it's like probably been about 5 to 10 years that you've been struggling with undiagnosed Hashimoto's, and now your thyroid is actually atrophied to the point that the immune system has been chipping away at it, right? Or maybe it's like a wait and see approach until your intestinal villi are so destroyed on an endoscopy that we can actually see like, oh yeah, did you know you have celiac disease? It's like, no, that's probably been progressing for years now, but we're actually seeing the tissue destruction now when maybe the celiac autobodies were present a long time ago, right? So just know though, even at stage 3, remission is still possible. We just have maybe a little bit more work to do and a little bit more timeline involved with that. So just know the key takeaway of discussing some of those 3 key stages is so that you understand you don't have to wait for a diagnosis to take action. Like more of a conventional diagnosis probably isn't going to come until full-blown stage 3 autoimmunity. But if you can detect autoimmunity earlier by either paying attention to your body, your own innate wisdom, your symptoms that you're struggling with on a daily basis, or working with more of a functional medicine piece to actually measure some of these autoantibodies, like now we're in the business of stopping it before it actually progresses, and you can kind of prevent from some of those full-blown tissue destruction, which is really cool. So when we think about, the differences in these diagnostic toolboxes, sometimes it's also helpful to know what are the different ways we can kind of test for autoimmunity patterns, and why maybe conventional medicine doesn't catch it very early, or why they miss the mark, and where maybe more of the functional medicine does have some diagnostic tools that are available for more of a preventative catch of things. So usually, let's just start from more of our conventional dying to surviving model. What they're going to typically look for are 2 things. Number 1, they're going to be looking for innate tissue damage. So whether that's imaging or a biopsy scan, or they're going to be looking for elevated inflammatory markers like your ANA panel, rheumatoid factor, erythrocyte sedimentation rate, or an ESR. These are different things that they're going to be measuring when they suspect things have gotten bad enough. Let's run a full workup for autoimmunity. But the problem is while those markers are good, that imaging is great, and those inflammatory markers are awesome, by the time that those markers are abnormal, significant damage has already been done. So it's going to take a while for those markers that they're looking for to be like out of range, when there's probably been damage being done for decades now. And rarely are we checking any antibodies very early, mostly because insurance won't cover it unless you already have very severe symptoms or an actual diagnosable code, which again, garbage care in my situation. So when we think about more of a functional medicine approach to autoimmunity, it's all about detecting things early before major damage actually happens. So some of the key kind of functional medicine things that I really dig into with my toolbox to help identify some of these autoimmune patterns brewing or building, and hopefully help people catch them in more of a stage 1 or a stage 2 before it's full-blown stage 3. Number 1, let's just start testing autoantibodies earlier, even before symptoms appear. I always tell people, again, it's my initial intake lab that I run, and doesn't even matter what symptoms you have. Like, I'm going to run some basic inflammatory markers and some basic autoantibodies, because to me, it's better to rule it in and rule it out. So if we rule it out and it looks great, awesome. Now we can rule that out and have that peace of mind around it, but we don't just wait and see. It's like, no, I'm going to run that pretty much standard for everybody. So we can definitely test these things earlier. So some of those examples, like we said, would be like TPO antibodies, ANA panel, even some of your inflammatory markers, like a homocysteine, a C-reactive protein. Like, we need to see and identify early stages of total body inflammation is really what we're looking for here. So we can do autoantibody testing. We can also do inflammatory testing a lot earlier. The other place where I tend to catch a lot of silent autoimmunity or even reactive autoimmunity is in the gut. Are we surprised? Probably not, because 80% of our immune system actually lies in the gut. So stool testing for things like leaky gut, intestinal permeability, any of those hidden or stealth infections, and just microbiome imbalances in general. These are all major autoimmune triggers that are happening, okay? So a lot of those autoimmune patterns actually start or are progressed based off of long-standing gut dysfunction that nobody has helped you identify. And don't think that you need to have gut issues to have gut dysfunction. A lot of times gut issues can manifest as neurological things, such as joint pain, numbness, tingling, tinnitus, headaches, migraines, or even mental health, whether it's anxiety, depression, mood swings, right? So gut doesn't necessarily just mean, oh, do I have a rumbly tummy and do I have like chronic diarrhea or chronic constipation? It can also manifest in other areas of the body as well too. So gut testing really, really helps us catch some of those early stage, like either silent autoimmunity or some of the reactive autoimmunity as well too. And then we also, last but not least, do have the ability, although I'm not going to say that I start here with everybody because I don't think everybody needs to go through this extensive level of testing. I'm just letting you know what's all available, is toxin or heavy metal testing, okay? It's definitely well known and well connected that toxin exposure, mold exposure, heavy metal exposure, pesticide exposure, especially if you have some genetic variability that doesn't make you a super great detoxer, those are all known to be autoimmune triggers, okay? So a lot of times it's helping people put the full picture together, whereas conventional medicine maybe has measured, like I said, thyroid levels and some of the general stuff, and they're like, well, ship shape. And you're like, then why do I have the joint pain, the brain fog, the debilitating fatigue, the swelling, the weight loss resistance, the gut issues, the skin issues, right? It's like, I'd probably listen to that, and we can actually do more in-depth testing that probably will give you a more proactive answer than just waiting for your basic labs to look like a disaster. Things are going to be very, very well progressed by that point if you're just kind of like, oh, wait and see, okay? So key takeaway here for you guys today is really, it's just if you only rely on kind of the diagnostic toolbox of more of that conventional medicine, more of the dying to surviving, that's okay, but just know that you'll likely be told everything looks fine, everything looks normal, and you may not see the early stages of your immune system being on overdrive in that situation. And so by using just that diagnostic toolbox, don't be surprised if your overall autoimmune diagnosis doesn't come until years after some of these like seemingly come and go mystery symptoms aren't resolved for you. And this is, like I said, exactly why people go so long and feel so terrible without having answers. You have so much more control over your immune health than you've been told. You do not have to sit around and just wait for a diagnosis. You can start healing now. So now that we kind of understand how autoimmunity develops, how we can detect it a little earlier, the big question, which I'm sure you guys are now naturally thinking about, because me too, is what can I do to stop it right now? What can I do to stop some of that progression from happening? Next week, we're going to dive into how more of this functional medicine toolbox approaches more of our autoimmune healing and autoimmune remission patterns. So stay tuned for that one. But at least hope that this episode gave you a powerful new perspective on autoimmunity, one that helps you feel really confident about taking action before it progresses into full stage 3 autoimmunity to actually get some answers. Fully knowing that we can see and detect things when we know what to test for within that more silent autoimmunity or even in that reactive autoimmunity stage. And if you're looking for some personalized help in this, definitely go over to the link in my bio, head over to, it'll take you right to my website where you can schedule a consultation together where we will run your autoantibodies and take a look and see whether autoimmunity is part of your picture or maybe it's something else, right? It's always positive to rule things in as well as rule things out. So check it out and don't hesitate, like I said, to book us a consult to get some answers for yourself. Otherwise, stay tuned for next week because we'll have part 3 of our autoimmune series next Monday.